Hello, my name is Gabriella Ward, and today throughout this presentation, I will be covering my quality management / performance improvement presentation on enhancing nurse communication during shift changes, specifically on the handoff process. Throughout this presentation, I will cover the main elements, which will involve a program overview. Then I will cover the idea for improvement, which involves a description of the problem, the organizational setting that this is taking place in, along with a description of that, the significance of the problem, which highlights the issues arising out of the improvement program. Then I will cover my data analysis, which includes an evaluation of the program, and lastly, I will provide literature support to back my position and analysis. To start with an introduction on enhancing nurse communication during shift changes, to provide a brief overview, I have chosen to utilize a hypothetical organization, namely Bright Health Medical Center, and the focus of my research is on the challenges related to nurse handoffs during shift changes. Continuing on with the main elements. The problem statement for my quality improvement program is at Bright Health Medical Center, miscommunication during shift changes has led to frequent oversights of critical patient information, such as medication adjustments, blood pressure changes, and other significant procedures that happen throughout the shift. Consequently, patient safety and quality of care have been compromised, particularly in high-pressure units such as the ICU and emergency department. Now, despite the dedication and hard work of the nursing staff, the lack of a standardized handoff procedure contributes to these ongoing issues. My goal statement is to enhance nurse communication during shift changes at Bright Health Medical Center by developing and implementing a standardized handoff protocol, while the aim is to improve patient safety, ensure the progression of care, and reduce the incidence of medical errors. This initiative will involve collecting feedback from nursing staff and patients, testing new protocols in a specific unit, and gradually expanding it to other departments with continuous monitoring and support from management and hospital stakeholders. The measure tool utilized for this specific quality improvement program is the FMECA, which essentially stands for Failure Modes, Effects, and Critical Analysis. This table allows for accurate identification and resolution of potential failure modes in the nurse shift change communication process, ultimately contributing to the enhancement of patient safety and care continuity. And the most important thing is to overall reduce errors related to communication among nurses, which in turn would focus on patient satisfaction as well as nurse job satisfaction. Here is a detailed description of the measure tool utilized for this quality improvement program. The procedure essentially involves 5 steps in total. Step 1 highlights the beginning of the process where there is commonly missed critical patient information, such as medical changes, vital signs, and blood pressure changes. Step 2 addresses incomplete documentation, while Step 3 identifies the communication barriers arising from the surrounding environment. Step 4 highlights the possibility of inadequate nurse training on new protocols, potentially due to short staffing and the occurrence of new nurses training other new nurses. And finally, Step 5 emphasizes the failures leading to the updating of electronic health records. As you can see along the top, I have identified the different categories for judgment, including potential failure modes, potential effects on failure, the severity based on a scale of 1 to 10, potential causes, occurrence based on a scale of 1 to 10 also, current controls, detection, risk priority number, the recommended actions, the action owner or who will be responsible, the target date, and lastly, the status. Continuing on with the main idea for improvement along with a description of the problem. In understanding the Six Sigma DMAIC method, Leiter emphasizes that a crucial element of a successful improvement initiative during the defined phase is to possess a thorough understanding of the process as well as the desired goals and objectives for this transformation. This particular quality improvement strategy aims to enhance patient safety, improve nurse communication along with handoff procedures, and lead to better health outcomes. Here are a few important things to note. It is important to note that this strategy is an improvement plan and not a way to point fingers at the hardworking nurses, but instead to devise an effective plan to assist the nurses and improve health outcomes and communication. It is crucial to recognize that everybody makes mistakes, as stated by the Institute of Medicine Committee on Quality Healthcare in America. The study conducted by Kahn on the concept of to err is human was of great significance. The primary objective within healthcare settings is to improve overall safety and reduce medical errors. A key point to grasp from this approach is to err is human emphasizes that the issue lies not with incompetent individuals in healthcare, but rather with the need to create for safer systems for good people working within them. Continuing on with the organizational setting. This quality improvement strategy will apply to a hypothetical organization called Bright Health Medical Center, which is a mid-sized hospital situated in an urban area catering to a varied patient demographic. A new quality improvement strategy is a necessary approach to address the prevalent miscommunication and deficiencies in patient care during shift changes. That short period of time often results in the discussion of crucial patient details such as medication adjustments or blood pressure fluctuations. However, they can often be overlooked or missed. In order to meet the specific needs of each department and focus on enhancing the standards of high quality care, the specialized departments involved are the intensive care unit and the emergency department. The support services required to facilitate this new approach would include the hospital's IT department, human resources, stakeholders, and department managers. The IT department specializes in the use of digital tools to drive the quality improvement approach. Additionally, the human resources would play a crucial role in providing training and creating a supportive environment for the staff. The stakeholders and department managers will ensure the efficient and effective implementation of the new quality improvement measure. Given that both the ICU and ER are high traffic and high stress working environments with a constant flow of patients, it is essential to establish a standardized handoff procedure to minimize errors and incidents that could disrupt the work environment and patient care. Continuing on with the significance of the problem along with the issues arising out of the improvement program. Prioritizing precise and efficient communication during nurse shift changes, also known as handoff procedures, is essential in order to ensure patient safety and accuracy of care by recognizing critical care events that occurred throughout the shift. Nursing handoff procedures are the processes through which important patient information is transferred from one healthcare provider to another during shift changes or transitions in care. Here is an overview of the process on enhancing nurse handoff procedures. On the left, I have prevention of medical errors, which will lead to reduced risk of legal issues, reduced readmission rates, and improved patient safety. On the right, I have enhancing team communication, which will lead to increased efficiency, proper accountability, and improved nurse satisfaction. By engaging stakeholders such as nurses, management, hospital IT department, and gathering feedback from patient surveys, a structured approach to addressing communication during shift transitions can enhance the standard of care provided, resulting in a safer patient management practices and a decrease in medical mistakes. Implementing structured handoff procedures would encourage outgoing nurses to verify information before handing over responsibilities, reduce disruptions, and improve precision. On enhancing team communication, this approach eliminates any delays or waiting times for patients, ensuring that shift activities are carried out efficiently with detailed notes readily available for the incoming nurse. Enhanced patient satisfaction with care will result from patients feeling well cared for and the nurse being fully present without concerns about gathering previously shared information from the patient during the previous shift. In order to achieve this improvement, minimizing interruptions is crucial to ensure the delivery of high-quality care. Additionally, nurse educators and managers should work on implementing efficient handoff procedures between nurses to avoid overlooking important patient information such as medication updates, health progress, and treatments administered during the shift. Furthermore, enhancing communication protocols will enable incoming nurses during shift changes to be well informed about the patient's current condition and to know how to proceed with their care. Continuing on with the data analysis. Here is my process map for improvement. The primary objective behind this framework is to enhance nurse handoff communication by implementing a structured protocol where nurses have a clear understanding of their responsibilities and position when transitioning into a new shift. The process map I have developed comprises of 4 stages, each outlining the task at hand, a breakdown of the processes, and the individual accountable in each stage. These stages consist of pre-handoff preparation, handoff meeting, post-handoff actions, and continuous care. Here is my process map for improvement. As you can see, on the left I have the start and on the right is the end, all comprising of just 4 steps. Step 1 is the pre-handoff procedure with the actions including the outgoing nurse to review patient information, patient charts, vital signs, lab results, etc. Prepare handoff procedure, schedule meetings with the incoming nurse, and the responsible individual for those actions is the outgoing nurse. Continuing on to the second step, which is the handoff meeting, and the actions include that both nurses introduce and relay position, review patient information such as the name, age, and diagnosis, verify their understanding, and document the handoff. The individuals responsible for those actions are both the outgoing nurse and the incoming nurse. Continuing on to the third step, which is the post-handoff actions, with that including update patient information, verify patient records, perform bedside check, and communicate with the healthcare team. The individual responsible for those actions is the incoming nurse, so the nurse that is about to start their shift. And lastly, step 4 is continuous care improvement, with the actions including to gather feedback, review, and revise the procedure, as well as provide additional training. And those actions are responsible by the nurse manager and the training coordinator. All in all, this process will facilitate an enhanced quality of care by streamlining the process and ensuring that all relevant patient information is up to date, accurate, and minimizes the risk of information gaps or errors. Additionally, according to Leiter, in healthcare, knee-jerk analyses refer to quick reactive approaches to understanding and solving problems without thoroughly investigating the underlying causes. This kind of analysis often leads to superficial conclusions and ineffective solutions. Here are the key steps involved within the process map for improvement, along with a visual representation of the task, its expected costs, and a description. First, we have the implementation period, which would bring moderate costs, as testing within a specific unit of bedside nursing, given the large number of nurses and patients, could take approximately 4 to 6 weeks, necessitating adequate training and adaptation. Costs would be moderate, primarily associated with training and documentation efforts. Resource availability would bring low costs, a substantial group of staff that can be developed internally to support documentation practices, implement handoff checklists, training coordinators, and nurse managers. The allocation of set times would bring low costs for handoff reports to minimize interruptions and ensure comprehensive communication will involve low costs. with readily available internal resources and a brief implementation time period. Continuing on, in terms of feedback mechanisms, establishing systems for staff to provide input on the effectiveness of handoffs and identify areas for improvement will be cost effective, along with high resource availability, as it can be easily integrated with existing communication tools and only requires a short implementation period. Finally, designating a handoff coordinator to oversee and ensure the efficiency of handoff processes may necessitate additional staffing, which could result in moderate to high costs depending on the team composition. As for resource availability, while there may be existing staff available for these roles, there is a possibility that further hiring may be required. Continuing on with the literature support. In conclusion, the overall improvement strategy is to promote handoff accuracy and success along with stress reduction. According to Richter and al. 2020, the impact of organizational factors on patient safety, particularly in successful handoffs within healthcare settings, is significant. Richter highlights while poor patient handoff techniques can lead to negative medical and financial outcomes due to the ineffective communication, it is crucial to recognize that successful handoffs can be influenced by factors such as teamwork, leadership, commitment to safety, and adequate staffing. Hospitals seeking to enhance handoffs should prioritize teamwork and implement strategies that promote open communication, such as teamwork trainings. In terms of stress reduction, fostering a culture of clear communication can also alleviate mental stress for nurses, as it equips them with the information they need to approach their shifts with a clear mind, ultimately reducing the risk of burnout among the staff. Continuing on with the evaluation on the academic journal titled Multi-Level Psychometric Properties of the AHRQ Hospital Survey on Patient Safety Culture, Sora and Dyer 2010 conducted a comprehensive review of the literature concerning patient safety culture and concluded that enhancing communication and teamwork plays a crucial role in increasing nurse satisfaction and improving the quality of patient care. Their research highlighted that efficient handoff processes essential for ensuring patient safety can minimize errors and lead to better patient outcomes, ultimately contributing to higher job satisfaction among nurses and an overall improvement in quality care. With that said, this particular evidence supports the implementation of a new protocol at Bright Health Medical Center to benefit from these advantages. The evaluation's key metrics will concentrate on handoff accuracy, decreasing medical error rates, enhancing nurse satisfaction and retention, as well as improving patient outcomes. Additionally, direct observation by nurse managers will facilitate real-time corrections to the new handoff procedures. And finally, collaboration with the hospital's IT department will be essential to ensure the accuracy of electronic health records documentations. Here is another evaluation on the academic journal titled The Influence of Organizational Factors on Patient Safety, Examining Successful Handoffs in Healthcare. According to Richter and al. 2020, the impact of organizational factors on patient safety, particularly in successful handoffs within healthcare settings, is significant. Richter highlights while poor patient handoff techniques can lead to negative medical and financial outcomes due to the ineffective communication, it is crucial to recognize that successful handoffs can be influenced by factors such as teamwork, leadership commitment, safety, and adequate training. Hospitals seeking to enhance handoffs should prioritize teamwork and implement strategies that promote open communication, such as teamwork trainings. By involving hospital stakeholders, nurse managers, department heads, and hospital administrators in leadership roles, it is essential to ensure sufficient support and demonstrate a shared understanding to address these issues and enhance the quality of patient care. Continuing on with the support for improved handoff protocols, specifically on reduction of medical errors. Research shows that ineffective handoffs are a significant source of errors in healthcare. For instance, studies by the Joint Commission highlight that standardized communication tools can significantly reduce errors and improve patient outcomes by ensuring that all relevant information is consistently communicated. A specific example would include failing to meet the national patient safety goals of ensuring accurate patient identification can have severe repercussions on patient safety, the standard of care, and the reputation of the healthcare organization. As a result, instances of medical mistakes, inadequate treatment, misdiagnosis, legal complications, and patient trust would all be significant outcomes if patient identification errors occur. Continuing on with support for improved handoff protocols on achieving enhanced communication, improving staff communication is crucial for achieving the national patient safety goal, and failure to do so can lead to serious consequences for patient safety. Inadequate communication during patient transitions between care institutions can result in gaps in patient care, leading to ineffective education, missed follow-up appointments, and worsening health. Studies have shown that structured handoff protocols promote better understanding and coordination among team members, leading to improved collaborative care. Lastly, the support for improved handoff protocols on improved efficiency. Minimizing interruptions is crucial to ensure the delivery of high-quality care. Nurse educators and managers should work on implementing efficient handoff procedures between nurses to avoid overlooking important patient information such as medication updates, health progress, treatments administered during the shift. Enhancing communication protocols will enable the incoming nurse during the shift changes to be well informed about the patient's current condition and to know how to proceed with their care. Finally, here is a list of the references used throughout this presentation. I would also like to say thank you for taking the time to watch my quality management performance improvement presentation on enhancing nurse communication during handoff procedures. Your interest and engagement are crucial as we work towards a more efficient and effective healthcare system. Thank you again for your support and dedication to this important cause, and I hope you have a great rest of your day.